Today's news is about our schools and the continued spread of COVID Omicron variant. The spiking number of infections within the public schools compared to this past November 2021, 266 cases. From November until now, January 9th, the number of individuals infected is close to 3,400. Absentee rate is 16%. DOE said 91% of their salaried employees are already vaccinated. They have been able to add an additional 500 substitute teachers available to help out. The schools are doing all they can within their power to stop the spread and get it under control. They have set up vaccination and testing clinics. Today's news has to do with the continued spread of the Omicron variant. Past Wednesday, Honolulu's mayor held a press conference. He warned and urged all of Hawaii residents to get the booster shot, the third dose. He has been encouraging residents for a while now. Less than 1/3 of Hawaii residents have already received the booster. There is already evidence that having the booster is more effective than only having 2 shots. We need to realize that having 3 shots does not mean you are fully protected and you won't get infected. We can still get infected. However, having the booster will lessen the chance of becoming seriously ill. It will reduce how transmissible you are and lessen the chance of going to the hospital. So having the booster really can help. It is highly encouraged that everyone gets the booster shot. COVID continues to surge. The mayor, along with other health care professionals and officers, took turn during the conference. One healthcare officer, Mr. Veras, has said he can still be optimistic even when the virus continues to surge. There are early signs that the surge is close to hitting the peak and will start to decline. There are reasons to be hopeful due to the lower number of deaths, the lower number of people needing to go to the hospital compared to last summer during the spread of the Delta variant. That was horrific. We continue to be optimistic. We have plenty of ventilators, oxygen, PPEs, personal protective equipment. We've got plenty of those. The biggest challenge we face right now is staff shortages. There are not enough people that are able to go to work. The workforce is dwindling. Those that are able to go to work have to do double work, more responsibility, and take on double shifts, working longer hours. At Queens Medical Center in West Oahu had to close their facility due to not having 90 beds available because of staff shortages. The other reason is that if someone does have COVID, they can't place another patient in the same room. Therefore, the beds are blocked off. This is at Queens Medical Center in West Oahu. Staff shortages have never been an issue for over 40 years. It has impacted a variety of settings, from the hospitals to the schools. City and state officials are trying to figure out what they can do, how to control the spread of the virus. Last Wednesday, U.S. Representative Kai Kahele, a Democrat, said that Hawaii isn't doing enough. He posted a video explaining 10 things that we should do, including increasing testing, more safe travel restrictions, more access to high quality masks. If you want to watch his video, click on the link. Today's news is about the continued spread of COVID. Hospitals are now facing a staff shortage. They are also grappling with another shortage: very low supply of blood. Blood Bank of Hawaii has said their facilities are on the verge of running out, and now they are at a crisis level. It is a life and death crisis. It's tough and very alarming. With such a shortage of blood, there is a huge need for donors to donate blood. Sometimes hospitals now and then will experience a shortage of blood on their shelves. To put this in perspective, if hospitals only have 20 pints of blood and a patient gets into a car accident, that patient will need more blood than what the hospitals have available. 20 pints is not enough. As the depleting of blood continues, the Blood Bank of Hawaii is making a cry out for help. They are badly in need of donors. One woman, a donor, last name Kong, she had said she's never really been crazy about donating blood, but she goes ahead and donates blood at least 3 times a year, and she's been doing this for 20 years now. She feels like it's a way for her to give back. A long time ago, her brother had surgery and he needed a blood transfusion, and very touched by that. So she decided this is a way for her to give back. The process is very short and simple. And when you donate that blood, it could actually extend a person's life for 45 years. So if blood runs out and somebody has a car accident, or someone has a heart attack, or is in need of a surgery, these procedures cannot happen because there is no blood. Nugent had said that over time, they've had a short supply of blood on hand. That's nothing new. But completely on the verge of running out and in a crisis, this is history in the making. It is an all-time crisis. Here in Hawaii, as they're running out of blood, they can't cry out to the mainland and ask them for help because they are in an even more dire situation than we are. So the donor, Kong, had mentioned, really, it's no big deal. The process is very simple, and as you go over time, when the needle is in your arm and that blood is taken out, it only takes about 7 minutes. There's different sites in town as well as in Waikele and Kapolei Commons, as well as at the Windward Mall. If you want more information, go ahead and click on the link in the notes.